You're watching Real Health, and thank you so much for tuning in. Now, there's been a lot of excitement about platelet-rich plasma therapy, using the body's ability to regenerate in order to heal itself and promote good health. We've invited into studio Dr. Nicole Canaris and Dr. Mark Opperman to find out more about how this PRP therapy can be used. Welcome to the studio, both of you. Thank you for joining us.
Hi, Michael. It's good to be back.
It's always good to have you. It's wonderful to chat about some very interesting things, and I think this particular one is one that I find quite fascinating. So what exactly is platelet-rich plasma? Where does it come from and how is it processed?
So it's really simple. It's like taking a blood test when you go to Lancet or Ampath and they stick a little needle here.
Right.
1 tube of blood, we put it in a centrifuge, spin it down. Depending on which kit you're using, it can take 5 to 20 minutes, and then it separates the blood components.
Okay.
So the heavier red blood cells will spin down to the bottom,
Right.
and your platelet-rich plasma, which is your platelets suspended in a higher concentration than what they found in your normal blood,
Okay.
are suspended in the plasma.
Right.
And that's what we extract and re-inject into the body.
Okay.
So the science behind it is that if we look at the constituents of blood, the red blood cells carry oxygen.
Yes.
Your white blood cells is there for the immune system, and platelets is responsible for clotting.
Okay.
So if you think about creating an injury where there's blood coming out, something needs to clot
Yes.
there and then create the healing process.
Okay.
And that's where the growth factors that are in platelets
okay.
come into its own.
Okay.
And that is what we harvest in platelet-rich plasma.
Could this be used in any sort of injury in the body?
So for many years now, back in the 80s, they've been using it in maxillofacial surgery,
Okay.
orthopedic surgery,
Right.
cardiac surgery, and even recently they're injecting into the ovaries for
Okay.
infertile women to stimulate egg production.
Okay.
So wherever it's injected, it causes regeneration.
Right.
So if you inject into cartilage, there's new cartilage formation.
Okay.
Bone, new bone formation.
Right.
Skin, new skin formation.
So as I understand it, it's really just about you're giving the body what the body has anyway in a far more concentrated form, so that more activity around healing happens at the localized point where you've injected it.
Absolutely. And what makes this so brilliant is the fact that we harvest it from you.
Yes.
It's not something that was manufactured. It's not something that was synthesized. It's something that's in you. It's your own ability to heal.
Right.
So it's a cost-effective way of stimulating recuperation.
Okay. Now, we're going to be talking a little bit later on and in another episode about its use in sexual dysfunction and helping to aid that process. But what are some of the sort of more common uses that you guys are seeing or is happening in the medical field in terms of using PRP?
Well, I think you'd have to differentiate male and female.
Right.
And if you're looking at females, female sexual dysfunction, and then the urological causes like your stress urinary incontinence. So we're able to treat these quite successfully by injecting PRP into the female genitourinary system to regenerate it. So improve the collagen in the area for tightness,
Right.
helping with the glands that are secreting for lubrication, tightening ligaments, improving muscle function,
Right.
and then increasing your nerve supply and oxygen supply.
Okay.
So there's more sensation felt.
Right. So in terms of, if I could just touch on that a bit further, in terms of what it's doing, it's not necessarily that there's damage as such, but from age and degeneration over time, is that the benefit?
So definitely, you obviously have young women who maybe don't have sensations and they may have an issue, and then we're able to boost that. But definitely menopausal women with low estrogen levels.
Right.
It becomes dry, it's atrophic, so you're basically just helping them boost the natural environment.
Right, right. And in terms of men, Mark, what is the result of the use of PRP?
So platelet-rich plasma in men, we're using for a variety of sexual disorders, from erectile dysfunction to Peyronie's disease. And for those who don't know what Peyronie's disease is, it's a curvature in the penis that forms due to plaques of connective tissue that forms. So we use it for that. But you know, Michael, to go back to what you've said, what do we use it for? PRP is incredibly widely used in orthopedics. That's probably one of the most common places we use it in. In aesthetic medicine, now both Nicole and myself are aesthetic specialists, and we use it a lot in rejuvenation of skin,
Okay.
pigmentation, pore size,
Right.
all of those things. So
Okay.
neurology is also a very big field
Right.
for platelet-rich plasma.
Okay. Now, Mark, just going back to the cosmetic side of things, in terms of like muscle relaxing injections and things, which are becoming more prevalent, is this basically a more natural solution to that, or would it be a different result, more a repair to damage than?
It's more a repair to damage than
Okay.
it is a neuromodulator in a sense.
Okay.
With our toxins, what we're aiming for is a decrease in muscle movement.
Yes.
So platelet-rich plasma is actually going to have an opposite effect.
Okay.
So, but you know, it is there for repairing damaged tissue, anything from scarring
Right.
to pigmentation, which is a form of skin damage.
Okay. And would that be something in terms of the cosmetic side, if I've got a scar that I've had for many, many years, is it ever too late to start doing some kind of therapy to rejuvenate that scarring?
So never. There's different types of scars. So it would all be dependent on how you got your scar, what level
Okay.
it's at, if it needs a subcision. But yes, it can definitely be treated.
Okay.
So PRP for the face is not just for problematic skin. It's helped to
Yes.
rejuvenate the skin.
Okay.
So it's going to tighten, it's going to give you glow, radiance,
Right.
all the things that you want in a natural way. So the world's
Okay.
moving in a natural direction now.
Yes.
People don't want toxins. Everyone's vegan. They want to go
absolutely.
with like a green direction. So this is the
Yes.
green direction to say, we're giving you something that's from you and it's
Yes.
completely natural to
Okay.
rejuvenate and regenerate your skin.
Absolutely.
One of the things that we have to emphasize, though, is that not all PRP or PRP treatments are equal. It
Okay.
really depends on how the platelet-rich plasma is prepared
Okay.
and how it's used.
Right.
So, you can't, for instance, just go to one of the laboratories and ask them to take some blood and
Yes.
have them separate the blood and take that and take it to your esthetician and tell her, use this.
Okay.
That, it's a no-no.
Okay, so you really need to find a specialist.
You
Special
need to
kits.
know what you're doing with this. There is special kits that we use to separate this, to give us the higher percentages. There's a couple of pitfalls that you can run into with
Okay.
PRP.
Well, that's something that I did want to touch on. I mean, in terms of risks or overuse of the therapy, can you take it too far? Is there a beyond cautious point that you need to be aware of?
I love that question because in its aesthetics, everyone always asks that.
Yeah.
Can you get carried away?
Yeah.
And obviously you look at Hollywood and all these beautiful people that some of them have gotten carried away with certain treatments. But because this is natural, no.
Okay.
Anytime we inject your skin though, it does pose a threat to
Right.
developing pigmentation, something that we
Okay.
called post-inflammatory hyperpigmentation. So that would be your only true risk. Then as Mark said, we keep it safe. It is blood, it is blood products. It has to be done in a medical sterile setting.
Yes, yes.
And make sure it's your own because there are infectious diseases out
Yes.
there. So you need to go to somebody responsible, reliable and
Okay,
trained.
Fantastic. Well, if viewers want to get hold of you guys to find out a little bit more about this, how can we get in touch, Mark?
My practice is in Parkmore, and the easiest way to get hold of me is on 011 784 1168. Nicole is in Greenstone, and your phone number is?
011 524 0991.
Okay, fantastic. And we'll also put your information on our website so people can find it there. Thank you so much for joining us. It's great to chat about some different therapies that are out there and have some great potential benefits. So thank you for your time.
Thanks.
Thank you, Mike.
Thanks a lot.
Thanks.